It is important to understand what the OSCE is all about. I get a lot of nurses having a lot of fear of facing the OSCE. So maybe unknown fear. Main reason you have the fear for the OSCE is you don't have enough information what the OSCE is all about. All of you are a qualified nurse in your own country. You know the basics of nursing skills. This OSCE is all about assessing your competency, identifying whether you are a competent nurse. Can you look after the patient safely? So basically, knowledge and theory which you have learned and the practical skills that you have learned, can you apply them safely in the clinical area? So maybe an IM injection, maybe doing a wound care, cleaning the wound and doing the ANTT procedure, or inserting a nasogastric tube. These are all the skills you know it. But most important is, do you know them in the OSCE format? Do you know them in the UK format or UK healthcare standard requirement? So that is why you will have to practice a little bit as per the OSCE standard requirement. And once you practice, you will be okay to give it. In OSCE, what do they do? How do they assess? Now, many of you not come across or faced the simulation training or simulation assessment. OSCE exam is done in the simulation environment where you will have a dummy or a mannequin used as a patient, and examiner might be the voice for the mannequin. Or you might have a real actor acting out as a patient where you have to assess the patient and manage the patient appropriately. So there are list of skills, list of things that you need to complete in the OSCE. Let me look at where do you need to start. So whether you are in your own country, you have not reached the United Kingdom yet, where do I start the OSCE? How do I prepare? My best advice is, first thing, there are a lot of information in the public domain for you. So let me share the screen and I'm going to open a test center website for you. There are 5 test centers at this moment where you can go to any test center and open the information. There is a lot of information for you to prepare for the OSCE. So let me go here. On your search page, whether it is Google or whether it is you use the Safari, type OSCE, any test center. I've typed here OSCE Ulster. The first link which comes in here, open it. That's the Ulster University OSCE page. You can scroll down on the front page itself. So you can go down and have a look at for adult nursing. Under adult nursing, there are a lot of important information for you to prepare. I would suggest first thing is understanding basics of OSCE. For that, I would suggest look at preparing for your OSCE first. So that's the first page I would ask you to advise you to look at. So if you look at the important information, what is OSCE? How do I prepare? Equipment, what does API means? Common errors, marking and moderation. I'm going to highlight important things here. All right, there are 4 different types of OSCE: adult, children's, learning disability and mental health. If you're for adult nurse, preparing for adult nursing, look at that. You have already completed the computer-based test. Now is the objective structured clinical examination, which is a practical simulation-based exam where you will be assessed for your competency, whether you are completing the skill or API scenario properly. That means whether you are applying the knowledge and skills that you have safely in the clinical environment while assessing and examining the patient. How do I prepare for the OSCE? What to expect in the test center? So there are some pictures here what this test center looked like. Simulation test center, where this test center cubicle where you will be here and performing the exam. Equipment, the different types of equipment used. I'll show you a separate document again. And how many stations are there in your OSCE? Current OSCE is 10 station, which might change frequently. So you need to have a look at it. So, and then what does API consist of? What do you need to do in API? You might need to do a communication directly to the patient and assess the patient. And then what are the skills are assessed or the stations assessed in the adult nursing? So they have listed here children's nursing and mental health nursing and learning disability nursing. Common mistakes can happen in the OSCE. So what are those common mistakes which you can avoid? And how do they mark your performance in the OSCE? If you pass all the 10 stations, you will be awarded as pass. If you fail up to 7 stations, you need to retake the 50% of the cost, retake the stations that you have failed in. If you fail up to more than 8 or more stations, you will have to take 100% of the cost, and you need to only resit the stations you failed in. And if you if you fail all the stations, you will have to, after the 3rd attempt, you have 3 attempts to pass the exam. If you fail in the 3rd attempt, you will have to wait for the 6 months and retake the OSCE. So this is a very important document for you to look at. So next important document for you to look at is, I would suggest, is the equipment list. Look at quickly the equipment list. What type of equipments are used in your OSCE? Okay, very, very important for you to look at. Okay, these are the equipments they will be using, or you will be asked to use, whether it is the thermometer, whether it's a blood pressure machine or pulse oximeter. Have a look at these equipments. So next document I would ask you to look at is the supporting document. So supporting document, what do they give here? In this supporting document, what sort of paperwork they use? Medication chart, community medication chart. How does it look like? The layout of the community medication chart. Hospital medication chart. So they have listed all the documents here. So please have a look at it. News chart. Okay, so do you know how to mark the blood pressure, pulse, respiration? Please go through that. So next document to look at is the station timing. Each station, how many minutes do they give you? So let's look at the skills first for adult health. So all the skills are listed, how many minutes you get in the exam for you to perform the skill. Similarly, API. So what are the scenarios they are using? How many minutes do you get for assessment, planning, implementation, and evaluation? So next one, very, very critical, I always suggest for you to look at is the marking criteria. What's this marking criteria is all about? Or I had people asking me, do they give me the marking criteria in the exam? No, these are the marking criteria for the examiner to look at whether you perform in the same standard. Marking criteria where examiners use to check whether you're performing all the criteria listed here. So let's look at one of them. So for example, care planning. How do you need to write the care planning? Anything you miss from here might, have the examiners have the rights to fail you. So let's look at one of the skills, administration of inhaled medication. So they exactly listed what all things you got to cover. So before you go to the exam, so what you need to prepare. All the skills and API marking criteria listed under marking criteria, please go through with that. So that will give you an overview of OSCE to understand what the OSCE is all about. Guys, my name is Gilbert Maris. I am from Health Skills Training. My important part here is what is OSCE is all about? How do I prepare initially for OSCE from my own country or once I come into UK? So the basics of information are available in the public domain under Test Center website, where you can go in without the login information and then print out some critical information that gives you an overview of the OSCE. Understand how many skills are there for your OSCE, how many API scenarios are there under API assessment, planning, implementation, evaluation. What are the scenarios are there, and specifically what paperworks are there for me to prepare. Maybe news chart. How do I practice preparing the news chart? Please don't forget to go through our online learning videos. All the videos of skills and API, please go through them several times so you are ready when you come to the classroom training. Don't forget to practice in the classroom before going to the exam. A lot of people just do the online learning and then go to the test. So you might struggle using the equipment on the day. So it's all about timing. If you've been given 8 minutes, how do I perform in 8 minutes? Communicating, completing the skill and completing the paperwork within the 8 minutes. So as I said, come down to health skills training to have a classroom practice, and we have all the equipments ready for you to practice.